Initiative was formed in 1996, and actually we were working on it in 1995 when the hospitals, the two hospitals and the University Health Center docs were looking at a merger. And at the time, we were wanting to talk about what the new health system on the Hill would be looking like and convened a conversation with healthcare providers in the community to talk about health and well-being. And that was a fantastic conversation that ended in early 1996 with the question being what really creates health, and the fact that most of what creates health in people really isn't about the healthcare delivery system, but is about the conditions that people are living in the community. And if we want to improve health of folks in the community, we really need to be looking at poverty, how clean the environment is, what job opportunities there are for people to really help them live well and live in a healthful way to improve their health and well-being. So it started as a way to engage the whole community from multiple sectors of the community to really talk about what does it look like if we had a healthy community, what's getting in the way, and how can we work together in ways that we've never worked together before to improve the well-being of the people in our community. When I think about what's been accomplished by the Champlain Initiative in these past 17 years, I think I look at it really from a process place and then from an outcomes place. I think that in terms of specific deliverables, things that have benefited the community and continue to benefit the community, a lot of the work that was started early on in the Champlain Initiative has resulted in, for example, Vermont 211 being created. That started as an implementation team way back in 1996 when the community said we think people have a hard time getting access to information. And at that time we started a community team called 1-800-GET-INFO, and as technology advanced and partnerships advanced, we were able to, over the years, grow that into what has now become Vermont 211, which is a fantastic information and referral service for people all over the state to connect them up to resources that exist. We also, as a result of the Champlain Initiative, the nonprofit organization Mobius, the mentoring movement, was created. And that started as a community conversation, really looking at how are our children and what are the predictors of kids succeeding or not succeeding, and how do we really address that. And having a caring adult in your life is one of the strongest predictors of school success that there is. So we had the conversation, what does this community need as it relates to mentors and mentoring, and what kind of capacity can we add? I think separately, and probably more significantly, is the change in the way this community really addresses how we tackle some problems that exist in the community that impact all sectors of the community, all people in the community. And when we started the Champlain Initiative, people were really addressing needs by sector only within that sector. So the nonprofit community took care of the poor. The business community took care of creating jobs. And we started to really have a conversation about how interconnected all of these sectors were, and how the needs that we were all struggling with really needed and required all sectors to come to the table. And I think the way this community today addresses needs that arise is fundamentally different from the way that happened back in 1996. We now always think about who has a stake in this issue, who should be at this table, who's investing resources in this, and how do we get everyone to the table, talk about what success would look like, and really create a shared strategy to get to that place of success. That is very different than it was in 1996, and frankly it's very different than many other communities across the country operate, the way they operate. It's very unique, and I think it has made a significant difference in the relationships and the partnerships that have really led to very innovative solutions to community problems. Very early on when we started the Champlain Initiative, we made the commitment that we were really going to measure the impact of our work on community health and well-being. And so very early on in the process, we made the commitment to start producing a community report card. It was called Champlain Counts, and it really was a way to talk about the impact of our work on community health and well-being indicators. It also was a really nice opportunity for us to get individual people to really understand what difference changing behavior could make. So we really tried to, when we were creating the Champlain Counts documents, talk about what's the data telling us, what are best practices, and what does this mean to each one of us individually in terms of how we live our lives, the decisions that we make, and really what difference changing those decisions can make. Champlain Counts, I think we probably produced 5 or 6 versions of this community report card, really looking at the indicators to see how the Champlain Initiative's community work was really improving health and well-being. We also had a team called Get Moving Champlain Valley, which was really early on looking at how do we increase physical fitness and physical activity. And a team of volunteers created this really nice program to get people moving. It was since adopted by the Governor's Council on Physical Fitness, and now the Vermont Department of Health uses the Get Moving Vermont program really, again, to encourage people to be moving and active in the community. I also think back to when we started having the conversation about what is the Champlain Initiative, and it's really the intersection of economic success, environmental soundness, and social health and well-being. And we got talking about sustainability and what is a sustainable community. And this was back in the mid to late 1990s when that really wasn't common language to be used. And a group of community volunteers did a tremendous amount of work and created a study called The History of Sprawl in Chittenden County. And that really was the beginning of this community having a conversation about planned smart growth and sprawl, and what does that look like, and what's the impact on our downtowns and on health and well-being. And I really think that document began the conversation in this community around what do sustainable communities look like, how do we become more mindful about how we're planning and where we're planning to build and grow communities and to keep open space. So that was another initiative that really helped prompt some very significant change in thinking in the community as it relates to health and well-being and the built environment. I think that we learned a lot about how to bring the right people to the table, to really think about how decisions that we are making might impact other sectors. And I think really we have to just recommit or continue to commit to that kind of examination of what our community needs and what sectors do they affect. Perfect example is sort of thinking about health and all of the costs that there are related to poor health outcomes, and all of the conversations that we're having in this community about the built environment, where we're putting sidewalks, where we're putting roads, where we're building housing, and you know, starting to really connect the ideas that the built environment has a lot to do with the health outcomes of people in the community, and that if people have the ability to walk where they're going, or that, you know, buses connect to sidewalks, connect to neighborhoods and shopping, you know, we can really actually impact health outcomes. So we have to just commit to continuing to look at where these interconnections exist, and that we are engaging all types of people in these conversations so that those perspectives and that information really is brought to the forefront. I think we also have a changing diversity in this community, and we need to be attentive to who's sitting in on these conversations. These are important conversations with important decision makers in our community, and we need to really look at who's around the table and who's not at the table and should be at the table as we move forward, because the community's changing. I just really want to take this opportunity to thank all of the people that really over the past 17 years have been participating in the Champlain Initiative. This was sort of work that I began right when I started at United Way, and I had terrific leadership from Gretchen Morse to really position the United Way to be a convener of the conversation, along with many, many other partners, Fletcher Allen Healthcare, and all of the leadership. And this has been leadership that was evolving Early on, it was Rosemary Dale, Joanne Clavel. It was the Community Health Improvement Office, the President's Office. There have been amazing people from Fletcher Allen that have participated over the years. We couldn't have gotten this started without David Coates and Janice Ryan, who were our first co-chairs of the Champlain Initiative, and I think really were instrumental in bringing the right people to the table at the time when we really needed them. Also, as I'm reflecting on these 17 years and what's been accomplished, and is it time for the Champlain Initiative to sort of close the last chapter, I think that this is a case of an effort in this community, a movement in this community that really did its work. And it's been amazing work, and I think that there are now new champions picking up the work of multi-sector collaboration to really improve health, and it makes me so proud to have been part of the Champlain Initiative with all of the people who were so instrumental, all of our co-chairs over the years, the partners, the funders, and it's been a really nice journey, and I'm very proud of all that was accomplished.